Good morning. Thank you for joining us this morning for a conversation about early detection. My name is Brian Marlowe, and I'm chair of the board of directors for the American Cancer Society. We're in a crisis when it comes to the state of cancer screening in this country. We know that millions of individuals canceled or missed their recommended cancer screenings due to the COVID-19 pandemic. And we also know that removing barriers to screening is an essential part of improving outcomes for cancer patients. Preventative care is critical, we know that. And employers and unions are an important part of the cancer continuum because they provide benefits to nearly half of the U.S. population. Half of the U.S. population. They must and they can play a pivotal role in helping keep America's workforce healthy. That is why we're thrilled today to have a conversation, to host this conversation between the American Cancer Society and Color Health. And we're also grateful to have Dr. Carnival. We want to thank Dr. Carnival for joining us this morning from the White House as we stand shoulder to shoulder with her team to reach the moonshot goal of reducing, cutting cancer deaths by at least 50% in 25 years. No one can do this alone. No one can do this alone. And so I think today we're demonstrating the power of tremendous partnership, and I'm thrilled to be a part of this. We know that no one can do this alone. No one can do this by themselves. We must work together if we want to continue to improve the lives of cancer patients and their families and to end cancer as we know it for everyone.
American Cancer Society Cancer Action Network Board of Directors, and I am thrilled to be moderating this timely discussion with such an esteemed panel. Let's meet our panelists, shall we? First, we have the CEO of the American Cancer Society and the American Cancer Society Cancer Action Network, Dr. Karen Knudsen. Welcome.
Thank you.
Next with us is Dr. Danielle Carnival, Deputy Assistant to the Biden Administration White House Cancer Moonshot. Thank you so much for being here today.
Thanks for having me.
And last but certainly not least, Dr. Othman Laraki, former American Cancer Society board member and CEO of Color Health. Thank you for being here, too.
Thank you for having me.
Let's start this discussion with Dr. Knudsen. Dr. Knudsen, can you help paint a picture for our audience? How are American adults doing when it comes to following American Cancer Society's cancer screening guideline recommendations? What's the national screening report card, if you will, and why should Americans consider ACS guidelines a gold standard?
Yeah, so it's important to understand that guidelines result from a large research study. They're evidence-based and they are geared toward individuals of average risk so that any American can look at these guidelines, anyone in the U.S., and use that as an informed discussion with their provider to understand what's a screening guideline that's correct for them. It's so important to have that discussion because as we sit here today, we know that 1 in 2 men and 1 in 3 women will be diagnosed with cancer over their lifetime. And it is so critical for screening to be part of a healthy medical plan because early detection is key. Just to put some numbers behind it, early detection for cancer results in a 3 to 8-fold increase in cancer survival. Early detection is essential. And from an employer point of view, it's also the case that early detection reduces costs for an employer or someone who's been diagnosed with cancer. Early detection, on average, reduces cost by 75% for cancer care. So it's the right thing to do, yet we know that it's not happening at the numbers that we need it to happen in order to save lives from cancer. And that was exacerbated by COVID, but even prior to COVID, cancer screening is not happening at the rates that we need.
Thank you for that. Can you tell us what the top 3 or 4 ways are that the American Cancer Society is advocating to change the trajectory of cancer care and outcomes in America?
Yeah, so toward our goal of improving the lives of cancer patients and their families, we know it's critical to work across the entire cancer continuum. Everything from prevention to screening to providing guidance on treatment, survivorship, and even bereavement, because not everyone wins this fight against cancer, and our key stakeholders include both patients and families. But let's talk about the importance, again, of what I just talked about, early detection, prevention, and screening. So some things to know. One is to dispel the myth that just because someone has health insurance doesn't mean that they have great access to care. We know, and I can tell you from being a former cancer center director, that a large number of individuals who seek cancer care are unable to access it because they lack some of the basic needs in order to get there. That could be transportation, housing next to a cancer center, education about what it is that they need, what kind of individual they need to see, what to expect in that visit. So we help patients in 5,000 communities across the country bridge these gaps in the cancer care continuum and get access to care. The second is that we actually work actively on legislation and common sense policies that enhance access to care. Everything from ensuring that individuals have access to biomarker testing to help them match better to cancer therapy if they've had a diagnosis, to ensuring that screening is something that's covered in state and federal plans. But lastly, I would say something to highlight is the importance of educating the public about taking action and helping them do it on their own. Our own research studies tell us that 43% of cancers now are attributed to modifiable risk factors. 19% of that is smoking. 18% of that is associated with body weight, activity, as well as things that we eat and drink. So alcohol consumption and consumption a diet that is unhealthy is attributed to cancer risk. But there are other things that individuals can do. They can prevent themselves from developing infectious disease-induced cancers, like HPV-induced cancers. So this is something that we have a lot of work to do still in this country to recognize that uptake of HPV vaccination protects against at least 6 major cancers. And we have the power in this country, due to HPV vaccination, to all but eliminate cervical cancer, just to name one. So lots to do. It comes to access to care, to ensuring that someone who has a cancer diagnosis has everything that they need in order to have a successful treatment strategy and become a survivor for cancer, and as well to ensure that individuals can take action on their own behalf to reduce their cancer risk.
That's so important because there are some who would say that the U.S. currently has a sick care system as opposed to a health care system. Can you speak to the importance of shifting how the nation thinks about health care and prioritizing it?
Yeah, that's exactly right. So the time to think about cancer screening is well before you or anyone else in your family has been diagnosed. So to think about prevention, to go into your primary care physician office and ask, what is the right screening plan for me? We talked about the fact that screening guidelines are for individuals of average risk. But risk is constituted by much more than your age and your gender. It's your family history, your genetic history, your genetic risk of cancer if you know it, your risk of exposures, and your own health history. So these are all of the things that we'd like to empower patients to discuss as they go into primary care so that a tailored cancer screening plan can be developed for them. This, again, gives the best chance at cure if a cancer is detected. Early detection is key. And this is part of health care instead of sick care.
So why is it critical for all sectors to work together to create this kind of sea change needed to end cancer as we know it in this nation?
Yeah. So we know we can't end cancer as we know it for everyone, which is part and parcel to what we do at the American Cancer Society, unless we do it together in partnership with our governmental partners, in partnership with, with outside the industry, including biopharma, and with companies like Color Health. So this is a really important area for us to ensure that we can deploy not only the knowledge, but access to cancer prevention and screening and risk assessment.
So Dr. Knudsen, how do you visualize employers and other companies expanding their role to help ensure their employees get screened and take advantage of other prevention opportunities?
Yeah, it's a great question. So as a CEO myself, I think about this every day. Of our 3,000 plus employees at the American Cancer Society, I'd like to make sure that they have everything that they need to be guided toward the right cancer screening and cancer prevention plan for them. I fully believe in empowering the individual and empowering families to take action on their own behalf. And I know that I am joined by other CEOs across the country that connect with us at the American Cancer Society who want to increase the health of their population, understanding that cancer is one of the major costs for employers, but also it's the right thing to do for their employee base to ensure that everyone has an opportunity to prevent, detect, and survive cancer.
You know, that's a great way to lead us into the next conversation around coverage versus access. We know that healthcare coverage doesn't automatically mean access. So, Othman, tell us what you see as the employer's role in healthcare delivery.
Sure. And by the way, one correction from earlier, I'm not a doctor. I'm a product builder and developer, and I focus a lot on how to develop products and experiences for people that are useful, and I have the privilege of working with a lot of amazing doctors. Just jumping into the role of employers and why they're so critical and important to American healthcare in general, but also specifically for cancer, which is that, as Dr. Knudsen mentioned, employers and unions today fund about half of American healthcare. So half of the people in the United States get their healthcare through an employer or union-sponsored plan. And today, that kind of relationship tends to be one that's around providing the kind of financial coverage, right? That's how you get your card for your insurance and so on, and some benefits. But I think one of the big challenges that we have as a country is that we do not have given that we don't have a public healthcare system. Mm-hmm. A lot of the services that are really about access, where you want to minimize the friction and the barriers to access, that are very subject to, that tend to impact the most, like the types of services that are elective. Like if you break a leg, or if you have, if you're diagnosed with cancer, have a heart attack, et cetera, you go into the healthcare system, you don't have a choice. For all of the services that are related to things that you can delay or that you can choose to skip, right, that feel elective, those are very, very much influenced by the friction of access. Mm-hmm. And the reason why employers are so important is that, when you think about where does our life happen, it happens in our workplace, happens in our schools, or people's churches. Like there are only a few places that tend to really aggregate society in a comprehensive way. And I think employers are, given that they're the context of the financial side of healthcare for a lot of Americans, they're also the context through which a lot of their lives are led, and through, and I don't mean just physically, but also, that's a trusted relationship. It tends to be a longitudinal relationship where they have a stake in your health over time. It's not just, an actuarial one. Mm-hmm. And so I think from that perspective, that's where employers have an opportunity that is both beneficial, obviously, to the employees, but also for them and their bottom line in the long term, to be able to really support access to, the parts of healthcare that are actually inexpensive relative to the late stage, like you mentioned earlier, the sick care side of healthcare, which is today where most of our spending goes. About over 75% of, cancer spend is on the late stage acute care side, whereas we could actually reduce the overall spend a lot by moving a lot more of that into the early stage.
Thank you. Well, as we heard from Dr. Knudsen, large employers and unions in the U.S., they play a unique role in delivering this health care benefit to their members and their employees. So where do you see that the biggest opportunities are for them to enhance access, to drive stronger screening adherence?
Yeah, so from the opportunities in terms of like direct impact, I think there's, a few levels. And I roughly break it into, categorization, I think that Dr. Knudsen also kind of alluded to, which is, first is literally like visibility, understanding, like you can't improve what you don't measure. In speaking with literally hundreds of heads of benefits and CHROs in large companies over time, I have not met a single one who actually has access to important statistics like what percentage of my population is up to date on their colorectal cancer screening. And even less dimensions around, actually I have 100,000 people and they're distributed geographically, and maybe my, high earners, white collar employee subset of the population actually is up to date or more up to date, and then there are other huge segments that really don't have an access problem. So one is visibility. Second is implementing access-oriented strategies to take a lot of the care into either the workplace or at home, or taking a lot of the friction out of the different steps that people need to follow. Like when we have a system today where your payer is separate from your doctor, is separate from your diagnostic lab, separate from your pharmacy. And that separation is also where a lot of the people fall through the cracks. And employers can have a big role to play in kind of delivering an integrated system there. And then third is the relationship in a kind of post-finding state where if you have a positive test in a screen, oftentimes people will go for weeks or months before the next follow-up. And there too, there's a very important role in kind of reducing that time frame to compress move the stage of diagnosis earlier, and which, as Dr. K mentioned, has a huge impact both on the cost as well as the outcome side.
Early detection requires then some early action. Otherwise, exactly. Early detection isn't so useful.
I love that. Early detection requires early action. That's great. Thank you for that insight. Let's find out a little bit about cancer, the Cancer Cabinet, and the Moonshot Summit. So, Dr. Carnival, tell us about your role in the White House Cancer Moonshot Initiative, please.
Yeah. So last February, President Biden and First Lady Jill Biden reignited the Cancer Moonshot. This was something that was started back in 2016 when he was vice president, with the goal to accelerate progress for everything that touches a patient, from prevention through survivorship, the whole pipeline, like Dr. Knudsen talked about. And he came back in as president and said, I want to bring this back. I think we have a huge opportunity to set some big, bold goals. That includes reducing the death rate from cancer by at least 50% over the next 25 years, and improving the experience of people and their families through going through a cancer diagnosis, treatment, and hopefully survivorship. And so the Cancer Cabinet is how we pulled everyone together. And so my job is to, from the White House, coordinate. I see it in two ways. One, the work of the interagency, bringing together Department of Health and Human Services and many of its components like the National Cancer Institute and others, but also the Departments of Defense and Agriculture and Energy and the Environmental Protection Agency and Veterans Affairs. Really a whole of government effort to look at everything along the pipeline to make sure that we're driving prevention where we can, protecting people where we can, where we're getting screening in early. We have a robust innovation pipeline ready to step up and have new treatments and new prevention and early detection methods, and then carry people through and really navigate them through the process. The other side, with the same set of goals, is to help be a platform to show really great work being done on the private sector side, academic, nonprofits, who are stepping up to the plate and saying, we see these two goals, we've been on this mission for a while, like the American Cancer Society, and we want to join you. And so we do a lot of work with outside groups to make connections, form new partnerships, new actions, new collaborations that'll make a difference in delivering against those top-line goals.
We know that collaboration is important, but tell us how you and the other White House leaders see cancer prevention efforts such as increased screening for cancer, helping the White House achieve its Cancer Moonshot goal.
Yeah, so really specifically, the Cancer Cabinet identified 5 priority actions. 3 of them are of part of the conversation today, 3 out of 5. And I would argue all 5, but to close the screening gap. And we mean the one that was exacerbated by the pandemic, but we mean the one that's been there for a long time. And we know that there's an equity component there. To decrease the impact of preventable cancers. We talked about HPV screening, colonoscopies, nutrition, smoking cessation. To understand and address environmental and toxic exposures. So we are taking as I said, a whole of society approach to really saying, let's do everything we can. We put most of what's being discussed at the rest of ASCO in one, which is make sure we're driving innovation that reaches patients and communities. But we need that innovation to happen on the early detection side as well. And we're excited about some of the advancements that are going on there. And then finally, support patients. So this is the topic today is a huge focus of what we're doing as part of the Cancer Moonshot because of the numbers that Dr. Knudsen said. We know that we can prevent up to 50% of cancers, some estimates even more. We know that early detection increases survival rates and lets people get back to living long, healthy lives even after a cancer diagnosis for some cancers. So we know the work that we have to do on the early side.
Well, in this intimate conversational setting, can you share any exciting new upcoming milestones on the horizon?
No
always,
pressure.
always. I think the biggest things, the president along the lines of the State of the Union laid out 3 areas of focus for kind of Congress to work with us, but also for a broader effort from the administration. And one was looking at how do we update the cancer research and care system for this fight, right? Like the war on cancer and the National Cancer Act was reauthorized 2 years ago now. What does it look like? What are the differences we need? So we're going to be working on that potentially through looking at reauthorizing the National Cancer Act to build that system at NCI. We just had a smoking cessation forum last week at the White House. This is part of a broad effort to say, okay, we need to take an approach to make tobacco products less addictive and less attractive, but at the same time, we have to make sure we have the support structure in place to help people through the process of quitting smoking if that's what they want to do, and making the case as to how important that is. And the third is the president put out a call to have navigation services as a covered benefit for as many people facing a cancer diagnosis as possible. So many organizations have built this from the ground up in communities all across the country, but we want to make sure that it's recognized as an important part of the care system, and we're taking some steps to get that done.
Yeah, if I may, that's one of the reasons why the American Cancer Society actually is funding patient navigators across the country, because we know cancer patients are different, and that patient navigation closes cancer disparities and saves lives.
That's right.
Tell us if there are any things that other organizations who share the Moonshot mission can do to support this initiative.
Yeah, great kind of easy tee up for me. We, like I said, part of what we're doing is hopefully with this vision that the president has put out, inspiring additional action on top of what people are already working hard to do to deliver for people facing a cancer diagnosis. And so we serve as a platform to bring folks together, highlight those actions. People can go to whitehouse.gov/Cancer Moonshot. Individuals can share their stories of inspiration and hope and tell us how to prioritize the work. People can share ideas as to what more needs to get done, and they can share new actions and collaborations to step up and address these goals with a real strong focus on equity.
Thank you for that. So each of you all have brought forward some very critical elements. How does each of these elements of this path forward need to be balanced and executed in tandem to ensure maximum impact in people's lives?
Yeah, I'll keep going. I'm happy to keep the floor. I think what I'm excited about, what I heard was 3 very different kind of visions into the problem, bringing what they can to the solution, right? So we've set the broad goal. We can bring anyone together and ask folks to do more and to really contribute. But it takes organizations like the American Cancer Society, companies like Color, academic institutions across the country, really agreeing on what needs to get done. We know so much progress. You hear in the halls of ASCO so much progress that is being made, but that doesn't matter unless it's delivering and changing lives. And so all of us coming together to make sure that every part of the system is supported to get that done, I think is what I get excited about.
Yeah, we can clearly do more together in partnership. And, success for us, of course, is ending cancer as we know it for everyone. But part of ending cancer as we know it means ending the time that cancer diagnoses happen at late-stage disease and shifting more toward prevention and early diagnosis when cancer can be more readily managed. And I just want to give just a quick example of a call to action of something that we really need to do. We've talked about the exacerbation during COVID of screening. We know that 9.4 million Americans missed screening during COVID. We've still not made up for that. That's a call to action. But let's just take a cancer and explore it just for a quick second. Let's take prostate cancer. It's the most frequently diagnosed cancer of men in this country. This year, 2023, almost 1/3 of all new cancer diagnoses of men will be prostate cancer. It's a highly survivable disease if caught early. But we have no durable cure for metastatic cancer, for metastatic prostate cancer. And what we've seen through our research tracking every year since 2014 is a 5% year-over-year increase that keeps happening every year in this shift to diagnosis of prostate cancer of more advanced disease. We can and must do better for men, and early detection is key in order for them to survive. We know this is true. It's the second leading cause of cancer death for men, of this very survivable cancer. So this is where we are connecting with a lot of other partnering organizations to think how we can do better for men. And that's just one example And if we think about the overall cost to the United States, just for prostate cancer alone, 2019, before COVID, single year economic cost for prostate cancer is $3.3 billion. So it's the right thing to do from every possible perspective, but we know we can't do it alone. That's why the partnerships are key.
One thing I could also love to add on that is I think so far, obviously there's been huge amount of incredible innovation that's happened on the kind of treatment side, and kind of how to manage disease at all stages. And as it's been said, there's a 6 to 8x delta in survival rates and it varies per cancer, but where it's all in the same direction. Cancers that are caught earlier are way more survivable and cost way less to treat. And I think one of the big battles that in some ways has been there's still a lot of work to do, but I think we've had an incredible amount of successes around coverage. I think over the last 20 years, whether it was the Affordable Care Act, also employers actually doing a lot of work around increasing coverage. In general, there's actually a pretty good level of coverage or substantial improvement in coverage for screening, without copay for mammographies, colonoscopies, and so on. But we have equated coverage with access, and those are just two very different things. Mm-hmm. And I think that's what the last 20 years have taught us is that we have made a huge amount of progress on the scientific side, a lot of progress in coverage, but we have not made as much progress on actually, enabling access, which is where you see the numbers that, and even when you look at the reduction in mortality from cancer over the last, 20 years, the bulk of that was smoking and, some move on earlier detection. Mm-hmm. But the range that is still available is massive. If you look at, lung cancer, for example, today, only about 14% of lung cancers are detected at stage 1. For populations who are at risk, like either smokers or people who have occupational health exposure, like firefighters and so on, who should be getting a regular CT scan, today the adherence is about 6% nationally. So think about that. 94% of people who should be getting a CT scan are not today. Mm. If they did, that 14% moves to about 43%. That level of move is bigger than any therapy I think that has ever been delivered, mm-hmm. In the history of cancer, right? If it was a drug, it would be a blockbuster drug, mm-hmm. right? Maybe the biggest blockbuster drug that we've ever had, right? That's the scale of impact. And I think that's the opportunity. And in some ways, sometimes things that appear just like logistics and just they sometimes are easy to dismiss, mm-hmm. because people should just be informed and it's an educational problem and, it's their motivation and so on. But in reality, if it is a national prerogative to get people screened, because we know that it drives earlier detection, I think that is it is actually a huge, investment, and it does not come for free. Those are things that can be dismissed, but actually do not happen if they're not proactively, invested in and thought of as an actual goal and an objective.
I think on that point, I always think of three ways that we need to improve this, right? It's people understanding their risk and what the recommendations are. People, us being able to provide the removal of as many barriers as possible. We know it's a million things that get in the way of this from access. And the third is, I think for so long, a cancer diagnosis was so terrifying that there is a real fear. And so getting the messaging out there around the treatments we have, catching cancers early, the hope that's on the other side of a diagnosis, I think that's a huge part of what we can do to make sure that people get in and get those screenings.
Because that's true, that there is hope. The high watermark for cancer mortality in this country was 1991. And through research and the advances, and as you very correctly pointed out, through the implementation of prevention and early detection strategies, we've been able to reduce mortality by 33% since 1991 for the 200 diseases that we call cancer. Though we still have a lot of work to do. So I'm just going to say this. I don't think we can end cancer as we know it without early detection. In fact, I know we can't. And there will be more innovation in early detection and more innovation in screening more cancers will become screenable. So all the more important for us right now to make this part of everyone's routine, to understand that screening and early detection is part of a healthy strategy for any individual or family.
You know, you all are so very passionate about this. This is very critical to moving the needle. And tell us a little bit about, as the CEO of Color Health, you've been working with companies to move this needle on preventive care and population health for several years. In your own words, can you share your thoughts on corporate responsibility when it comes to healthcare for employees?
Yeah, absolutely. I know. I think it's kind of interesting, actually. I think one of the interesting dimensions for employers is that there's a strong desire to also not be paternalistic, right? Like it's kind of the relationship of an employer relative to your healthcare is a tricky one. On one hand, you are funding it. On the second hand, you really depend on it. Like I think through the pandemic, we saw like how existential the health of your employee population is to business continuity and survival. But on the flip side, there's a dimension of like freedom and privacy and so on, and like a lot of healthcare issues are also at the intersection of like social debate, if you will, right? And so I think it's a bit of it's huge stakes, but also there's a lot of thoughtfulness that's necessary there. But I think what's been happening increasingly over time is that I think historically employers had been much more in the mode of like we're responsible financially. It's almost more of a structural social mechanism by which collectively in the United States we implicitly decided that employers were going to be the funding mechanism for part of the country, but there was not a direct kind of like responsibility necessarily. But I think the side effect of that is that with that power in some sense, I think has come the one hand responsibility, but I think also just like opportunity, because it is one of the biggest factors in employee retention. Mm-hmm. All the innovation that's been happening, for example, in other sectors around, for example, to enable women to remain in the workplace, and still be mothers, and et cetera. Like, there's been just a lot of incredible like progress, I think, that's been made thanks to employers, having an agenda and that aligns with social goals in some sense. And I think cancer is actually one of those key, pillars of that, and represents, I think, a huge kind of untapped opportunity for good and impact, where it is the single, post-pandemic, now it is the number one cost for employers. So especially kind of going into tougher economic times, the prerogative of just moving the cost curve down, but also kind of just the direct impact that it has on, every single person's lives and their families. And the fact that employers are a social context where they're the point of intersection with people's lives, given how much they can influence that the actions, and kind of getting people to have access early so that, they do the right thing for themselves and their families. I think that's where, like, again, the opportunities, and really thinking of it separately as, yes, there's coverage, and then there's access. And the access is where really they can play an incredible role now.
So how can they play this role? What can they do to help close the gap so we can simplify access?
Yeah, and so I think in terms of, from that perspective, I think one is understand, you can't improve what you don't measure. If any kind of big core business line for a large employer, you go into the math, you go into the details and the statistics and tease those apart to understand the composition of those. Healthcare, after people's salaries, is the number 2 largest cost for employers in the United States. And today, it is a black box for most of them. We asked our healthcare plan to give us a breakdown of screening rates in our company. And literally, we got like a 2x2 matrix that had almost no information about it. And that was for like the number 1 cost in our plan. Mm-hmm. And so one is kind of understanding the details of where accesses are not available to the populations. And number 2, investing in the kind of all the components to take screening into the workplace, either physically or to the home. And then investing in services that remove the friction for employees and their families. Today, we say, okay, you tell women, okay, you should go get a mammography. Mm-hmm. But A lot of people don't have PCPs these days anymore, or a PCP that they have easy access to. So how are you going to get the referral? How are you going to find the place where you can get the mammography that takes your plan? And how are you going to manage the logistics of getting there and everything? And those are things that actually employers can really take a big role in removing all of those friction points that impede kind of the willingness and ability for people to take time out of their day and out of their life in order to be up to their screenings.
Okay. Well, I have one last question before we're going to move into a speed round. I want to ask you, Dr. Knudsen, in light of all that we've said, in light of all that we've heard, in terms of as it relates to the current healthcare system, where do you see that there may be low-hanging fruit, but a giant step forward for healthcare?
Yeah, well, I think with the focus on screening, I think I'd like to say there, I think if every American adhered to the screening guideline that's appropriate for them, we would make a significant improvement in cancer survivorship in this country. So I really do see screening and early detection as absolute keys for us to move the dial against cancer. You know, back to the prostate cancer example, pre-COVID, only 1/3 of eligible men were screened. Yet this is a very easy, cost-effective screen, and that's just one example. So there's much more that we can do together. I very much agree, with Othman in terms of those friction points that exist. Important to remember that someone of average risk going for screening is by definition asymptomatic. They're well. So it's very easy to push that off. I'll do that next month, I'll do that next year. I need my mammogram, but I don't have a PCP, so I don't have the script that I need to get it done. And that's about 4 levels of hassle more than I can deal with this month. And so I'm going to do that next year. So working with individuals, I think we can lay out the why and the path forward. But it's going to take partnership with CEOs and business leaders to hold hands and link arms so that we can facilitate their employees getting to the right cancer screening plan. We know everyone wants to do it. They start from a place of knowing that they should and wanting to get it done. But the data tell us, and there's only one way to interpret it, there are too many barriers. Because if there weren't, more people would be into cancer screening.
Okay. Let's go to our speed round. I'm going to ask each of you this question. Just very quickly tell me, if you had a magic wand and could change one thing about our healthcare system instantly, what would it be and why? We'll start with Dr. Carnival.
Oh, I'm going first. Okay. I think the focus on prevention as part of how we live and breathe as a society and how we incentivize the healthcare system is something we've been working on, but are not nearly there. And so I think when we look at the great advancements in early detection and treatment, they're going to save and extend lives. But we have a headwind on smoking still being a problem. We have obesity and diabetes being an indicator for cancer. And many other health conditions. And so I think changing our society's approach to what health is and how to stay on the health side as long as possible is something that I would use my magic wand to do.
That's great. I love that. So for my magic wand, I'm going to make it more patient-centric. So, I don't think it's convenient for anyone to try to go get their mammogram between 9 to 5, Monday through Friday. Right? And as a former healthcare executive, I can tell you what happens when you open up mammography on Saturday morning, or when you open up your infusion center nights and weekends like we did previously at Jefferson Health. That's a patient-centric approach to access, and it can be just as simple as changing a business model in order to give people more access to care. And then look what happened during COVID with telehealth. All of a sudden allowing people to remain in their home and have that connection with their provider that was so formidable. And that's staying with us. It's not going away anytime soon. So we're seeing this rapid acceleration of more patient-centric, family-centric healthcare at home or closer to home. And that's got to include cancer screening and early detection. So these are the kinds of things that I hope as they accelerate and we want to get behind them, that they remain patient-centric and we think about how it is that we can maximally remove these barriers by thinking how it is that we can get healthy individuals into things like early screening and detection.
Thank
I think my idea was like a little bit of a mix of both of yours in a way, but
we can make a Venn diagram.
Where I was coming, and was around what is one of the if I had to choose one of the big friction points to remove for patients in order to get immediacy of access, I do think it oftentimes is that complexity around coverage and where can you go and what will it cost you. Actually, we often run into people who think they will have a copay that they need to pay for a mammography, and that's actually an example of a big gap in kind of information that also prevents people. And so I would really want to make it a competitive market in the sense of an open market for delivering services, because I think that's one way that we can get a lot of immediacy for services. Like, for example, if there is demand, there should be supply.
Yeah.
And the fact that there isn't, it probably means that there isn't an open market. So I would that's where I would use my magic wand.
Totally agree.
I think each of your magic wands would have such a very positive impact on the healthcare system if we could wave it and make it so today. So I'm going to leave it here where you all have left us. I want to thank you, our esteemed panel, for your amazing insight, for your critical insight, for your informative, for the information that you have provided to our guests. And I want to thank our guests for joining us today. I want our guests to remember that screening is one of our most robust tools for eradicating cancer for everyone. And so we ask you, please follow the guidelines and get your screenings done regularly. For more information about this initiative and other information related to cancer, please visit cancer.org and please visit it often. Thank you all so much for joining us. And thank you again.
Thank you.